Hey girl, how are you? How was your night?
Good. That's pretty good, but I'm pretty tired. It's like third night in a row, so you know how that is.
Yeah.
But yeah,
Almost done.
Almost done for sure. So she's pretty good. This is my patient, Sandra Klein. She's a 30-year-old female. Patient came into the ED last night. Chief complaint of acute pain in the lower right abdomen. She has acute appendicitis. She hasn't ruptured yet, so we're just kind of waiting for surgery to get that taken care of, which I'm sure you want to get out of here as soon as possible. Surgery is going to be at 9 o'clock this morning. Her vital signs are a temp of 36.8, pulse 90, BP 116/78, and respirations are 16. She has consent already. It's in her chart and good to go on that. When everything's ready, we're just kind of waiting for the doctor just to prepare her for surgery and get out of here. Here's a list of the doctor's orders. We want to make sure that she has a type and cross-match stat. Wasn't able to get to that last night, just came in, and I want to get out of here. So here's for you guys.
Thank you.
And everything else, you're pretty good to go. All right? We'll see you around.
Bye. All right, Stacy, so here are your orders. Take a look at that.
Okay. Well, I see on here that the type and cross match hasn't been done yet.
Yeah, she said that. Weren't you listening?
Yes. Well, is that something you think we could do together?
Well, you are a new grad and you've been working for about a month now, so you should know how to do that. So I think you can figure it out. I'm going to go on my coffee break, and I'll see you later, okay?
Okay. All right. Hi, Sandra. My name's Stacy. I'm going to be your nurse today. How are you doing?
I'm okay. I'm just still waiting for my surgery. They said that it would be done pretty soon, and I've been
Hi,
waiting
I'm
for
Dr. Colley. Sorry, we're running behind in the OR today. How are you feeling right now?
I'm okay, just ready.
Has that type and cross match been done yet?
I haven't gotten to it yet.
You haven't gotten to it. That needs to be done
No.
stat. She needs to get to surgery.
I'm sorry. Yeah, I'm on my way to do it right
Why
now.
hasn't that been done yet?
I just got here. I'm sorry.
Are you a registered nurse or an incompetent CNA? We're behind in the OR. She needs to get down to surgery.
Okay. Yeah.
Okay, just get it done and call me. Stat.
I am so sorry. I'm so sorry.
Yeah, whole day down here. It's like that. Afterwards, we took a hike. It was so much fun. But like,
In the morning or the evening?
started in the morning, but then we wanted to like, I don't know,
Sorry,
it took
excuse
way
me,
longer
guys.
than expected.
Gabby?
But like, it's
Yes.
Sorry to interrupt you guys. I really could use some help with the type and cross match. The doctor really needs it like right now, and I was wondering if you could help me.
I told you I'm on my break right now. You said give me like 10 minutes, and you have my morning coffee, and I'll come help you.
don't you already know how to do that?
Okay. All right.
New grads, I know.
What do you guys think of the simulation?
I think it went well.
Yeah.
How did you feel,
Yeah.
Stacy?
Yeah.
It seemed pretty realistic. I definitely felt like I was being looked down on by everybody. There just wasn't a whole lot to work.
Yeah, just kind of like bullied for like not knowing
Yeah.
exactly what to do right off the
Yeah,
bat.
even when I was asking for help, like I was still getting looked down on.
And I felt so bad for you.
Sorry.
So, if this situation were to happen in the hospital, what would you do differently to kind of facilitate a friendly environment?
Well, I probably wouldn't leave Stacy's side right off the bat, right at report, and help her figure it out, look it up in the manual if we need to.
I think for my part, if the doctor was running behind, it's not something you should take out on the nurse because it's not the nurse's fault necessarily. And then also, if he does have a conflict with the nurse, he needs to take that out in the hallway or take it to the break room and not discuss that in a patient's room. And then when it is discussed, it needs to be discussed in like a professional manner. And there shouldn't be any yelling or, I guess, accusations made.
I also think it's like a really big opportunity for other nurses to jump in if they see it happening, just because everyone was a new nurse at some point. Like, they all know what it's like to like not know what they're doing. Another point is to never argue in front of the patient. Like, the patient should never feel awkward in their own room. They should never have like conflict in front of the patient. So just bringing stuff outside of the room also, if you have to talk loudly. You went well.
Yeah, I think we just need to focus more on that, patient advocacy and standing up for ourselves and making sure that our number one priority is for our patient and they're getting the best care that we need, and despite all our other conflicts, our patient needs to be first.
Right, like for
Everything else can be
example,
pushed
when you guys are
aside.
talking about your day, that should be happening later on instead of right in the morning when there's all these tasks that need to be done and you know
Yeah.
there's a stat order.
Yeah.
I feel like Stacy did a good job though, trying to get my attention. I was just kind of ruthless, shooing her off.
Yeah.
But you did a good job of like stating, I don't know how to do this. You need to help me. So you did a good job with that.
And it's also good too that she, like to bring up the point, she is asking for help instead of just trying to do it.
Yeah.
You know, if you need
Yeah.
help,
Yeah.
you should be able to ask
Always
for
ask
help.
questions. Yeah.
Yeah, you're very composed.
Yeah, overall, I think it went well.
I think it went well, yeah.